Hello, my name is Evelien de Leeuw. Although I'm normally based in Sydney, I'm currently in Montreal and speaking to you through this interesting new medium. In this video message, I'm going to convince you that health promotion needs to live outside the healthcare system, perhaps even outside the Ministry of Health. To make you see why, I need to reaffirm one of the assertions of the Ottawa Charter: health is a resource. Hospitals, doctors, pharmaceuticals help to restore it, but people, yes, nations need health to grow, develop, and thrive. In the words of American microbiologist René Dubois, health is the capacity to do what you value. Incidentally, Dubois was also the man who gave us think globally, act locally. It's worth detailing the you. Health is not only personal. It is made, sustained, and sometimes threatened in groups, communities, schools, workplaces, cities, and other settings. We all need it, and we all can create health. If health is a resource, we must embrace it as a capability, the thing that gives us potential to live our lives to the fullest, emotionally and economically, and yes, physically. Health is an asset. We can all, individuals and institutions, invest in it and promote it. As an asset, it will return on investment. Healthier communities are more resilient communities. Health as an individual and collective asset is owned and must be embraced by all, individuals, communities, and our institutions, most prominently by our city mothers and fathers, our politicians. When the Ottawa Charter was developed all those years ago, we found ourselves at the edge of the known universe for such a liberating view of health. We looked further afield with vision and aspiration. That vision was outward. How the world should embrace inclusive social, physical, and economic supportive environments. How other sectors beyond health should include health in their policies. How communities could and should take control of the things that determine their health, and how we should mediate and enable and advocate for that vision. And of course, how our own house, the health services, should reorient itself to a patient-centered, respectful, systems approach in which clinical decisions are equally co-owned by all, but most of all by the client and her family. But we need to look in. In our analysis of the success of the Ottawa Charter, it seems that the reorientation of health services has been the toughest of challenges. The clinic, the medical industrial complex, is a real tough nut to crack. And in a way, we remain locked in its hermetic capsule. I suggest that in our effort to advance health promotion in a policy and action responsibility outside the healthcare system, we need to look better inside that system. Is healthcare holding us back? Maybe, but we need to make our case why we're looking outside the health system. If health promotion happens everywhere, in cities and in workplaces, how can it be owned by the health sector? The promotion of health as an asset and not a liability it must be shared by all. It cannot be owned by the health sector. Maybe we need to call our effort life promotion and work across all sectors, institutions, and worlds where life is made and sustained. This, I think, would really liberate us. In my view, this is also the message and aspiration of the Sustainable Development Goals. Health may be goal 3, but health promotion has been and continues to work for a stable ecosystem, for healthy cities, for clean water, for clean soil and air, for economic development that gives, not takes, for equity, for balanced gender representation. Health promotion is life promotion is integral to the SDGs, to all SDGs. To which I add, from a very firm evidence base, that life promotion happens not out of ministries of health. It happens where people live, love, work and play. It happens in our streets and in our cities. I hope you enjoy your lunch.